Hi, everybody. My name is Emily Brown. I'm currently a first year BEF ambassador, and for the last 2 years, I was a Boomer Esiason Foundation athlete. I had the opportunity to sign an NIL deal while I ran Division One track and field for the University at Albany. And there, I specialized in running the 400 meter and the 500 meter. So we're just jumping on a call today with Dr. Virginia O'Hare, and we're just going to have a quick conversation on mental health.
Sounds great. Hi, I'm Virginia O'Hare, and I am a clinical psychologist with expertise in workable, short interventions for people living with CF.
So I guess you're probably the perfect person to talk to. Just about a couple general things. I know that I'm eager to kind of share about my journey as an athlete and, my continuing journey as somebody with cystic fibrosis, kind of navigating and growing up in the adult world. So I guess one thing that we could start by talking about is just routine in general. I know for me, routine and regimen is so important. And I don't just say that in regards to what I do medically, also on what I do on a personal level, because what I do personally kind of drives me on the other end of the scale. So if, I feel well, I know that it's kind of going to translate into how my PFTs are doing, my dedication and my commitment to a regimen and a routine. So just as far as the regimen goes, I know I learned in psychology class, my very first psychology class in college, that one of the hardest things for just any general person to do is take one pill a day, just one
Mhm.
medication. So, not 20, not 30, not 40, like other people that I know with cystic fibrosis. But just the audible gasp around the classroom was crazy to hear because I just sat there as somebody quiet, like, I'm wearing this invisible illness. I take next to like 50 pills a day, and everybody's shocked that taking a multivitamin can be a really tasking thing for them. Um, so I guess just in general, a couple things that I'd love to ask you about is
Mhm.
how, what are some ways that I could go about kind of following through with my regimen and my routine to kind of have it reflect better on me in terms of my mental health?
Yeah, sure. And I mean, from what I know of you, like your Ms. routine, like you've got this down pat, right? So I guess I would ask, like, what drives you, whether it's routine around your CF regimen or your routine around your like athletic training, like what really drives you to follow through on that? Like why follow your regimen at all?
I think for me, it's kind of like a multitude of things that have driven me. Of course, there's negative things that contribute to it, and then there's the positive spin that I put on it. And that's kind of what motivates me. If I can find something positive about my routine, what I'm doing athletically, anything that works for me, even just reading a book, I try to like reverse it back and ask myself, like, how how is this um, contributing to me overall. So, me as a person, I know for one, cystic fibrosis and what I've done athletically has given me a whole lot of perseverance. Knowing kind of
Mhm.
how to like buckle in, follow the routine to a T. And it's not, I know people with CF, they've always told us like, your health can change on a dime. And
Mhm.
that's something that has positively, but also negatively motivated me. There's that fear of I could get sick, my health could turn rapidly. A lot of the privileges I have right now in life, like pursuing graduate school in the fall, those
Mhm.
things could come to a halt if I ran into something medically with cystic fibrosis. So, one thing for me is I know that following my routine and doing the extra things that I do physically just to stay active because it makes me feel good, these are things that I find so important because as a person, it drives me, it gives me perseverance, motivation, um, it can make you feel accomplished just going and getting a workout done for an hour.
Yeah.
Just the way that you feel after the fact. So that would be definitely something that I would say positively contributes to what I do to help maintain my mental health on top of
And
CF.
I'm even here for the negatives, right? So it sounds like you've got feeling good, right? Like feeling like good, in yourself, in your body, etc. You got perseverance and like meeting a goal, right? Like those are great. And then I also heard you talking about, staying healthy for grad school. Like that's pretty awesome. What are you going to grad school for?
So I will be attending NYU in the fall for nutrition and dietetics.
Oh
So
my God, I love it. Yeah.
super excited.
And like there's yeah, and I'm happy to I want to I've got another question about that too. But then there's also the like avoiding something horrible, avoiding a horrible outcome, which is fine if that's also the driver, right?
Yeah.
So, I think I wouldn't discount the kind of wolf at the door as well, right? So we've got things that we're kind of reaching for, like grad school, feeling good, etc. And then things that we're kind of trying to not have happen, right? Like having the bottom fall out, taking a turn for the worse, etc. So I think from both angles there, we can kind of pull out like an underlying kind of direction that you want to kind of push your life towards. Like when you think about doing your grad program, what is it there that like you want to kind of give to the world from that?
I know that one thing that I want to give to the world is obviously I want to be a professional in something. I want to be able to contribute to society despite
Hmm.
having CF, something that automatically off the bat doctors tell you you have a shortened life expectancy. To me, I've never let that stop me in terms of school. If anything, it's just kind of like push me to, follow through with school, get it over with as fast as possible, minimize the gap years. You know what I'm saying? So I think for me, um, that's kind of been a big pusher is that um, if I were to get sick with CF, I want to be able to look back and say, I accomplished this. I followed through with my timeline. And that's definitely something that, like you said, is kind of like the big bad wolf behind the door. Is for me, it's not just fueled by, oh, I want to be a professional, I want to have a career. It's also fueled by the what ifs of what if I get sick? What if I want a family in the future and I need to financially fund that? But what if I get sick in the midst of having a family? Like, how do you navigate that? What is your relationship with your partner
Yeah,
like if there is a partner? So again, like I kind of see it as like a fear of the future. I do have a lot of fears regarding how my health will turn out, how my
of
life will turn
course.
out, just like any young individual. But also, I know that it's been a driving factor for me to stay motivated to continue applying to schools and to follow through with my education. Is I don't want to be sick and also let myself down on a personal level where I'm not
Yes,
following through with like my desires and my goals because I'm still entitled to those even though I have a terminal illness.
absolutely. And so from those, like I think about so if I it sounds like if I were to ask you like what's kind of your big why? What's like the thing that drives you to do the thing, whether it's studying at school, doing your CF regimen, training as an athlete. You said five things that I wanted to pull out and tell me if these kind of fit with you as like your big why, your big like why bother, why do it to the extent that you do it. So you got contribute to society, accomplish something, follow through. That sounds like it's important. And I heard you earlier saying like perseverance, have a family in the future, or at least have the door open to the possibility if you choose to have a family, and also being financially stable. Like those
Yeah.
seem like pretty good drivers. Anything else? Any other kind of big why that we're missing?
Um, I think another big why for me is like on a preparation level. I kind of like love that word preparation because it was something that was preached to me, coached to me as I was an athlete. If you don't take the right steps to prepare, like how can you expect to see yourself in peak form and peak shape, ready to do what needs to be done when it needs to be done? And I've kind of looked at life through the same lens. Is like it's all about preparation. I can't, write down on a notepad exactly what's going to happen in the future, but I can reflect on the things that I've done to prepare. So I think not being prepared or like lacking preparation is kind of another one of those five, now six things that has been like a driving factor for me.
Be prepared. Yep.
Be prepared
Right. Isn't that like the Boy Scout or whatnot? Like motto? Be prepared.
or
Anyway,
don't be prepared.
don't be prepared.
Be
That's
prepared.
great. Yeah. And then I'm wondering, like, so as you're moving towards those, as you're moving towards like be prepared, contribute to society, keep the door open for family, be financially stable, follow through, accomplish something. As you're moving towards those, is there anything that your mind kind of tells you in terms of like is there like a phrase or a sentence that really haunts you, that like really brings you down?
Um, I think just something in general, and I wrote about this in pretty much every college internship essay, every application I've done is like what the word terminal means to me.
Oh, yeah.
That for me has been a haunting factor, and I remember that since I was even a wee little kid. My mom would tell me, like, if you don't follow through with your treatments, you have a terminal disease. You know,
Hmm.
you will get sick, you will die. And you don't hear many parents telling their 12-year-old, if you don't do this, you will die. That's the
Hmm.
reality.
Yep.
And it wasn't told to me with a bow tied on the top and a pretty
Hmm.
pink. It was, the reality of the situation, because the earlier that they could get me to understand that, the better off I would be in terms of a regimen, mental health, me as a person,
Hmm.
what drives me to be successful. So, like, I would say that for me has been the haunting thing is terminal. What does that mean? What does that look
Yeah.
like? What's the timeline?
Yeah. And I kind of love this approach of like, let reality be real. Like, if it's here, let's name it, right? And like your mom's approach with, okay, here's the hand that has been dealt right now. How are you going to play it to the best of your ability? So, all right. So, does the word terminal? Because what I'm trying to get at is like we have a little trick we can do for kind of changing people's relationship to that thing that maybe your mind says. I'm aware that for different people it could be something different, right? It could be like why even bother, or it could be you know can't breathe, or it could be the word cough, or that sort of thing. And when you think the word terminal, it lights up this like whole neural network of kind of often bad associations, right? Oh, like I know whatever comes to mind when you think of terminal. What comes to mind for you?
I think for me, it kind of spells out the word failure in another sense.
Uh,
Like, if, and it's always applied to so many areas of my life, in school, in track, in going to the clinic and getting a bad PFT result. That word terminal for me just instantly translates to failure. I'm a
yep.
failure. I failed at this. I'm scared to fail. What if I fail? So I would say that's kind of something for me that has been like a bad association. Like, when I
Hmm.
tell myself I'm failing, it's really hard to kind of like flip the script and, get myself back into a, mindset where I can tell myself I can do this. I'm capable of it.
Okay, and I love how you're saying like the flip the script, right? So we can never get rid of that neural network that's lit up with terminal, like that failure. I'm imagining in the video game, the like game over sign at the end, right? So yep. So we got that. But what we can do is we can lay down a different neural network that's like more flexible, that's kind of funny, even. So that then when you hear the word terminal, it's not like you forget all of the bad associated with terminal, but you don't have to react in the way that that neural network is telling you to. So you don't have to react with doom and gloom or I give up or why bother or any of that. So, all right, are you ready? We're gonna do.
I'm ready.
You ready? Okay, good. She's like, I'm ready. She doesn't even know. She knows
Just
she's
throw it
ready.
at me.
So we're gonna say the word terminal back and forth, and then we're gonna say it back and forth in like silly voices. Think like a dog, like a cat. Maybe you're like Dracula, and maybe you're like I know Taylor Swift. All right. So let's first just say it back and forth a few times. Terminal,
Terminal.
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 Okay, you ready?
Terminal.
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 Beep, 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 beep. Terminal.
Terminal. I feel like we're talking about the airport at this point.
Right? Yeah, yeah, yeah.
The lower voice, I feel like embodies it. Terminal.
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 Yeah. So, and the next time you hear the word terminal, it's not like you're going to be like, brand new concept. You'll still have that kind of negative Nancy neural network lit up. But then another part of your brain will light up with this new learning of like you and me being silly, thinking about the airport terminal. I agree. My mind went to that also. And the idea then is like you'll have more flexibility to sort of choose how you go. Because you can imagine that there's someone who blows a lower PFT, thinks the word terminal, and then has the thought, why even bother? Screw it, not doing my regimen. Right. And there could be somebody else who thinks that and then doubles down. Now, all I'm going to be is my regimen. So
Yeah,
this idea is like, if you can sort of loosen the association between what your mind tells you and what you do, if you can kind of hold that lightly, like we'd hold like a butterfly that lands in my hand, it's like, oh, here's the thought of anxiety, and kind of let it go rather than doing everything you can to get rid of it. Um, then you've got more flexibility, and then you're choosing how you go about your life towards all of those things that are important to you, being prepared and contributing to society, family, financial stability, all of that. Does that make sense?
exactly. And like this kind of reminds me of like what you're saying around anxiety and thoughts like that. I know for me that's something that I definitely put under a microscope is like what is anxiety? Like what is this feeling? Why do I feel it so often? And like even when I have good positive things happen in life, I feel like I'm taken to this place of anxiety, like thinking about the future, almost
Hmm.
getting ahead of myself, but
Hmm.
not like coaching myself positively through those forward thinking thoughts. So, for example, like when I was running at UAlbany, my sophomore year, shortly after COVID, kind of came to a mini close and we were put back into school and told that we could practice with masks on, which, as somebody with cystic fibrosis, is insane running and practicing in a mask around your teammates. Like, oh, talk about like physically taxing. But right around that time, I kind of I was really thinking about my choice pursuing track in college. Like, where did this idea come from that I'm so motivated by track, but I know I'm going to school for the purpose of learning and getting a degree and to get a job eventually. So I just really started doubting myself and my performance and what I was capable of. And to me, that turned into a whole mix of anxiety. I would go to bed thinking about practice, which was 14 hours away the next day.
Mm.
I would be concerned all day long about did I eat enough? Have I eaten the right things? Did I eat at the right time? I can't have
Hmm.
anything sugary, not more than one cup of coffee. And I would guilt myself when, I would eat too late because I got out of class late, or I had to pick up a meal out because I needed to, but financially it's also a risk at the same time. And then not to mention going to a practice with a bunch of other, elite athletes who are very trained in their sport, and learning to compete every day. Practice just wasn't showing up. You needed to, work to your fullest extent every day to get the most out of your training. So I would go into it with this mindset of, I'm not good enough. I'm going to fail this rep today.
Hmm.
I won't be leading the pack. I ate too early. I'm going to throw up
Hmm.
everything that I ate and I'm going to lose all that caloric intake. How do I make up for that after practice when it's, almost dinner time and I have loads of homework? And then it started translating into competition where I was basically getting really, really bad cold feet. And I would always show up, I would always be on the line when the time came. But up until the second where the gun went off, the worries that I felt were just like they consumed me and everything I did, it consumed me. So at that point, I was already seeking therapy. I've been, in therapy since I was a senior in high school. And I just found it super helpful in general to just sit down and talk with somebody about things that are important, things that are unimportant. But therapy for me became kind of like my armchair to lean on when I was really struggling with anxiety. I would tell my therapist, like, I am having the most provoking thoughts about I'm not good enough, I'm a failure. And I'm like, I don't understand because I came this far. My PRs are better now than they were in high school. I'm so much more competitive now. I'm getting great grades in school. Like, why is this anxiety eating me up? It was basically eating me up to a point where I wasn't happy. I thought at one point I was going to quit college track because it just became so weighted on my everyday routine. Everything was about track with cystic fibrosis. It was no longer I run
Hmm.
track with cystic fibrosis. It was, cystic fibrosis does impact me running track. So I think for me, like anxiety became a big thing and like fear of the future. It was so hard to fight. And I've worked my way through it, but obviously seeking therapy and just talking about it in general has been an outlet to start handling the anxiety.
And I love that you knew to seek that outlet. I think that anxiety is one of those things that a lot of people suffer with alone, and there can be shame around it, or there can be like attempts just to get rid of it. Um, And even like think about all those things that your mind is churning out, like the whole like not good enough or may as well just quit. And it's true, if you quit, you might not have had the anxiety about it, but then you'd have thrown away that whole value of like, excelling as an elite athlete, right?
Yeah.
And doing track. So I'm wondering there too if there's a way, like, say more about what helped with anxiety. 'Cause anxiety is one of those tricky things where like there can be, your mind can tell you that if you're feeling anxiety, you should change what you're doing to try to get rid of the anxiety, right? Whether
Yeah.
it's quit track or, all the other sorts of things that we might do to get rid of anxiety. Could be like drinking, drugging. It could be like going into like a Netflix hole. It could be like, I know I'm a big like doom
I'm a big
scroller,
binge watcher. I am a binge
but
watcher.
or like I have anxiety at night and about something the next day, and I'm like, oh, I'll just like look at this thing on Instagram, and then oh, there's a related article, and oh wait, I wonder if anyone else is. Next thing you know, it's like hours later,
Rabbit
time is
hole.
wasted, right? So the thing with anxiety is you actually want to do the opposite of what your brain is telling you. You want to find a way to fully make contact with it, right? And I wonder, when with your experience in therapy with anxiety, was that ever the message, like to
This
be
was
present
that
with
was definitely the topic of conversation a lot of the times when I brought it up, and like I said, just talking about it was step number 1.
it?
It
Hmm.
took me months to even talk about it and explain to him this overwhelming feeling, and honestly, the more I talked to him about it, the more I started feeling the anxiety even
Hmm.
worse. I would be at practice, I'd be like, "I just talked about this in therapy, and now I'm struggling 2 days later." So it came to a point where eventually I was asking him, like, how do I navigate the anxiety? Because if I quit track, I'm gonna be basically, I will feel like a failure. I'll feel like I
Mm.
succumb to all the negative feelings and doubts that I keep telling myself I'm having. Um, and the
And
main
you'd
thing that
lose all the good that you love about
exactly.
track. Yeah.
And that's the thing, I was losing all the fun, it was sucking the life out of me, I was no longer, like, having fun with it, it was becoming more of, like, "Why is this mentally taxing?" So, upon speaking with my therapist about it more, I was letting him know, like, "I'm doing all the right things, I'm performing well, I'm, like, running with the group, it's not like I'm behind." I was like, "But mentally, what's slowing me down is my thoughts." So he basically asked me, he was like, "What is your thought process when you get to a meet?" And for me, I was one of those athletes who would put their headphones in. I would lock in. I'd shut everybody else out because I felt like I needed to focus. But that focus at the same time provoked these terrible thoughts of anxiety. The whole time, instead of telling myself, I'm going to run this race and I'll do it well, I'll do it to my best of my ability, I would tell myself, I'm probably going to go out there and not run this to the best of my ability. I'm probably going to go out there and I'm going to have a terrible start. I'm not going to kick the right way when I need to. I'm going to finish the race and be upset with, oh, I didn't follow through. I didn't put all my energy out there. So he started talking to me about fully embracing my anxiety.
Mm.
And what that looked like was taking out my headphones and not playing the music all the way up until the point of the meet. It started becoming, when those feelings of anxiety came on, okay, take a deep breath. What I'm feeling right now is anxiety. I've been here before. I felt this feeling. I
Mhm.
just need to recognize right now that's what it is. Okay, so step number 1, I recognize that it's anxiety. Step number 2 was, after I've embraced it, find something to distract myself from it in a good light too. And that was like going and talking to some of my teammates, like
Yeah, I
getting
love
myself out of
that.
my head, having
Yes,
fun with it again,
that's
learning how to
great.
giggle 5 minutes before you're out on the line. So that to me was something that once I changed my outlook, just in that really small way, even going to practice and having fun with it and goofing around in between
I think
reps.
it's a pretty radical way, not a small way.
Exactly.
Yeah.
I needed the goofiness. I needed that side of fun because it helped me recognize, like, I have anxiety just like everybody else out here that feels nervous. I
Mhm.
feel that too. And I might feel it to more so other extents or a deeper extent because
Mhm.
of, like we talked about, the background of CF, that big bad wolf at the door. But to me, it was about just recognizing the feeling, not making it about the CF, not making it about terminal or
Mhm.
any of those other bad failure words, and instead just kind of like trying to remember why I even started track in the first place. And
Okay, I love this so much, and I know we're running out of time, but I
you're
wanted
good.
just to I wanted to take a highlighter to like oftentimes when we're getting closer to our value, that's when our mind churns out all of those negative thoughts, right? Give up. You're never going to make it anyway. You're going to, choke. You're not going to be happy at the end. And it can be so tempting to let those thoughts take the reins. And I love that instead you found a way to, you know what, I'm going to take my anxiety along for this run, right? I'm going to run with my anxiety. Here it is. Welcome. And like talking with your friends, that's just like the absolute opposite of what anxiety wants you to do. So I think that that's great. And I think that, whether folks who are listening are thinking, oh, I've got anxiety about this other thing or similar thing, the idea of like not even trying to get rid of it, just what if we change our relationship to it? What if we kind of bring it along like you bring along, a puppy? We're like, all right, here you are. Here's anxiety. All right, get on my back and let's do this run together. Because oftentimes the more anxiety, the more it's a signal that you're moving towards a thing that's super important to you.
Yeah.
That makes
And
sense?
that was what somebody always reiterated to me. I had multiple teammates that would say to me, like, Emily, do you know why you're nervous? Do you know why you're anxious? Because you care. Because
Yes, exactly.
you share a risk in it because you care about what you've done in
Yeah.
preparation this far. So I do think like it applies to so many other areas. And I felt that anxiety lurk, into my appointments behind me and as I finish my PFT and I await the results, like, but it's something that I've learned like anxiety, I don't feel like you control after the fact or before it comes. You control anxiety in the moment. And
Yes.
the
I
quicker
love
that
that.
you can embrace it and deal with it in that second, you kind of prevent those bad thoughts from being drawn out and drawn out. So, that was definitely a life changing thing for me. And it brought back the fun into track. And I just think overall, it was definitely a period mentally where I was really, really drugged down by a lot of different things going on in life. But being able to recognize it was kind of like a cushion for me in my mental health. It definitely gave me an avenue to be able to navigate the anxiety and also like look back on the lessons I learned from it and apply it to what I'm doing right now that's not athletically motivated.
And I love like what you're describing, your experience fits very well with the sort of treatments that I do with folks with cystic fibrosis and also with other chronic health conditions, which is acceptance and commitment therapy or ACT. And it could be, with someone who's like ACT inspired or someone who's doing like straight up ACT. And it also doesn't have to be treatment that you do for years and years and years. Like sometimes, a few sessions can be like a really nice sort of tune up or a nice like little spark of mental health in your life. So I
I
love
think
that.
trying any person who has CF or something that's like CF related, I think trying as many things as possible, as many avenues as possible,
Mhm.
not just medically on a treatment level, but mentally in a mental health, help me work through this level, embracing therapy and even conversations like this just about mental health and realizing the role that it plays in CF has been so vital to me because I feel like the earlier I can recognize it and get on top of it, the more control I'll have over it in
Absolutely.
the future. And I hope everybody else listening can kind of pull that from our conversation as well, that you are in control, and always seek other avenues. Don't be ashamed to kind of delve into mental health because anyone with CF knows that it definitely plays a part.
Absolutely. Thanks so much for inviting me to chat with you.
Of course, Virginia, this was really fun. I definitely learned a lot from this conversation.
Thanks.
Um, and I know, I'll be letting that big bad wolf in and put my arm around it.
I love it.
Beautiful. Thank you. Have a great
Thanks.
day.
Thanks.